Hi everyone. So I wanted to talk to you a little bit just around Lighthouse and our history with NHS and the social care sector. So from a personal point of view, I've worked with NHS for more years than I care to remember, probably around 15 years. And I think personally, we had a calculation a couple of years back, I've probably trained about 400 or 500 managers within the NHS. So why do we work so closely with the NHS? I think there's a real as everyone in the country has, there's a real passion and energy for people who work in the NHS, what they do, and we try and share that. And I think one of the things around healthcare, similar to lots of other professional organisations, is you train all those years to become a nurse or a doctor, or to even become a CEO, a director of an organisation. What you don't necessarily cut into that is the fact that at some point I'm going to have to manage people. And that's kind of where we come in. So often the delegates we've got on board are highly experienced clinicians. As I said, we've worked with people from, newly qualified nurses, perhaps moving into their first supervisory role, right up to directors, CEOs, those running services, those running sort of bigger departments of acute hospitals and things like that. And I think the one thing they always struggle with is, I've got all this clinical expertise, I know what I'm doing, but when it comes to people, no one ever taught me that. No one ever sort of said, actually, how do I book holiday? How do I deal with someone who's perhaps had some absence? How do I manage someone who's not doing what they should be doing? How do I inspire and motivate? How do I get my staff really loving what they do and wanting to do more? And that's kind of where we come in. So over the years, we've worked with a number of NHS organisations. Just to sort of drop a few, at government level, we've done some long-term contracts with the Department of Health and Social Care and the UK Health Security Agency, formerly Public Health England. But along with that, we've worked with a range of acute hospitals, so the Norfolk and Norwich Hospital. We've worked with the James Paget, Cambridge and Peterborough, West Suffolk Hospital, just to name a few, but also within the mental health sector, so Norfolk and Suffolk mental health, and Cambridge and Peterborough mental health. And alongside that, we've done a lot of work with surgeries, perhaps looking at people who are practice managers or aspiring practice managers. And again, they just want that little extra sort of skill around dealing with people. One of probably the favourite programmes we ever delivered was for Health Education East of England, and that was around system leadership, which is a really big thing at the moment. With everything that's going on, all the different services need to work closely together. And this was quite a pilot programme at the time that we delivered, which was pulling together your traditional acute hospitals, mental health services, third sector, GP practices, even some private organisations who worked within that. And that also included other emergency services like ambulance, police. Probably, I don't think we had anyone from the fire brigade, but we might have done. But it was all around how they could work together. And that personally, the things that came out of that, the stories people went away with. And one particularly sticks with me around working. In one of the groups, we had someone who worked for the police and someone who worked for mental health services. And there was a real them and us culture, because often, as everyone knows, the police are the ones that end up dealing with perhaps urgent mental health cases, and they're trying to get people in to help them. They end up having to take them to somewhere safe. And one of the other mental health people in the course had said to the policeman, well, really what you guys should be doing is getting some mental health training. And the policeman, quick as you like, turned around and said, well, what you guys need to do is work a bit more than 9 to 5. And it was a very tongue-in-cheek moment, but there was a moment there where they said, you know what, we're not doing enough to pool our resources. And I know from that particular project, there were 2 or 3 outcomes related to that. And these were only local issues, that we weren't going national at this stage, but it was really interesting for people to just see the world as others seen it and try and work through looking at the patient, the person at the centre of this. And that's kind of what we try and bring to it. So what do we do with the NHS? So we've got a range of different interventions. Obviously at the moment we're doing a lot of apprenticeships because people are keen to use their apprenticeship levy. And generally we're offering those at level 3 for first line managers and level 5 for sort of department managers. But we're also doing a lot around coaching for those who want to develop their coaching skills. And a new one we've recently launched is Learning and Skills Mentor. And that's ideal for those who want to support others to learn, not necessarily from a managerial perspective, but actually from sharing their skills. So in the NHS, they talk a lot about preceptorship, where new nurses are supported. This is a similar skill, but often used in less clinical ways and more around developing people with other skills. So we run these programmes either in-house, so if you've got a large number of delegates, we can ask you to pull them together. We'll come to you and we can work specifically for your organisation, and that allows us to embed your own policies, your culture, your challenges, inviting guest speakers, people from your organisation to really share their experiences. And some of the best ones I have is where senior leaders come along and they just tell their story and they say, this is how I started, this is what I had to learn along the way. And it really inspires people to think, oh wow, okay, you know, they weren't always perfect. They had to learn as well. So some of those stories are great. But also bringing in experts, you know, people who might talk about things like data, which, you know, a lot of people just don't understand. People to come in and simplify it, to talk about how the finances work, to help support how HR does what they do, to make people, you know, safe and looked after and all those different things. So there's a great opportunity there if you do it in-house. The other way we do it is to look at what we call open courses. So sometimes you don't have a group of, you know, 12, 15 managers ready to go. So what we can do is invite them to join a group where there's lots of people from different organisations. And whilst that doesn't allow as much bespoking from your organisational perspective, it allows people to look up and out and discover how other organisations work. And sometimes that's still within the health and social care sector, but sometimes they might be in a group with someone from engineering or food manufacturing, and you think, well, what can I learn from them? But it's the stories I could tell just around where people have had those moments where they've thought, that's exactly the same. So different context, but actually we're all dealing with people. And I know from some of those workshops, there's people who perhaps were in a programme together 4 or 5 years ago that I know still keep in touch. So it develops that network, that support. And again, the programmes start regularly. We can pretty much start you when you want. And the opportunity is there to take. You know, you want to understand coming into the programme what you want to get out of it. So we'll take you through all the materials, all the skills and knowledge and behaviours that you have to develop, but your journey is the most important one. So behind all that, we still look at, well, actually, why are you here? What do you want to get out of it? So you can all have those takeaways. And the big thing that we started doing around a year ago now is we got together with the NHS Leadership Academy and became one of the few providers that are able to add Edward Jenner programme and the Mary C. Cole programme into their apprenticeship programmes. So the Edward Jenner is a standalone one, and that works with most apprenticeship standards. So it sits within the level 3 team leader, but it can also be put alongside things like Learning and Skills Mentor, Business Administrator, even coaching. You can add that in, and that kind of stands alongside. That's an e-learning programme. But the really exciting one is the Mary C. Cole programme. And this is something we've worked really hard on to take what's in the programme, which is all about the NHS. It's all about what your challenge is. It's absolutely talking your language. And what we've done very cleverly, I think, is embedded that in to the level 5 department manager apprenticeship. So those who attend that will have around 2/3 of the programme will be all the things that we cover around, you know, leading, motivation, planning, all those different things. But then you'll have a stint within your programme where you will go completely onto the Mary C. Cole programme. So you're talking about the same things, but very much with an NHS focus. And I think the people who've gone through that so far are already starting to say how powerful that is. It really is bringing all this to life within the context of the NHS. And I believe we're one of few providers who've been approved to deliver that. And for lots of people, that's really, it brings something to it. It's not just management training, it's NHS management training. And again, the passion and energy that our tutors have, our trainers have, to bring that to life is fantastic. So, you know, if you want to learn more, get in touch, have a chat with us, see what's going to work for you, and hopefully we can work together soon.